Hello there, how we doing? I'm going to try to arrange this a little bit better than last time. I know that I'm not a technology person, but I'm going to do my best here so to not cut off the screen like I did last time. And I think that's about as good as we can get. And I apologize for the screen going up and down. I think it's going up and down to my heartbeat, actually. Okay, so this is abuse and rape. Last lecture here. Let's go on. Chapter 11 in Bedebeck. Let me just make sure we got it. We do. There are many types of abuse. Abuse is defined as wrongful use or maltreatment of another. There's child abuse, spouse abuse, elder abuse, patient abuse. Abuse can take many forms, thus making it difficult to define, therefore making data collection difficult. And of course, nobody admits to abuse. Epidemiology, and that is causation. No, excuse me, statistics. Neglect is the most common form of abuse. Emotional abuse is the second most common. Women more prone. 20% of ER visits by women are for abuse injuries. 78-year-old, most common age for abuse. Older the person and more debilitated, more prone to abuse. This makes sense because they need care. They're not independent. So if they need care and the caretakers aren't caring for them properly, that's considered abuse. About 50% of children who live in a household where a spouse is battered or abused themselves. And again, when people live or children live in a household that is abusive, sadly, that becomes their norm to some degree, and they don't realize how bad it may be because they grew up with it, so it just seems normal. And of course, it is not. Spousal abuse can occur in any type of relationship, same sex or opposite sex partners, doesn't matter. Married, unmarried, occurs at any socioeconomic level, so it's non-discriminating. Common characteristics of abuser: strict disciplinarian, believe in physical punishment, meaning they probably grew up with physical punishment. Overly jealous or possessive. Again, violent family of origin, there we go. Low self-esteem, possible substance abuse, and a history of abusing animals. That is a very good indicator of a lack of empathy. An antisocial personality disorder, if we go back many lectures, there could be a history there of abusing animals. Because when you don't have empathy for an animal, that's a lack of empathy. Okay? Cycle of battering or abuse can be applied to any type of abuse. There are phases here. Phase 1 is the tension building phase. This may last days, weeks, or months. Perpetrator is smoldering. They're angry at something. They're feeling frustrated. He or she displaces anger onto significant other. That's what SO means. By verbal or light physical abuse, yelling, pushing, things like that. The person with low self-esteem may rationalize that the abuse is their fault and possibly feels they deserve to be abused. And I say low self-esteem because what a person with healthy self-esteem would say, I'm not tolerating this, I'm leaving. Okay. Um, this person may try to placate the significant other by making everything perfect for their spouse, cleaning the house, getting dinner ready. The kids are always kept quiet. Again, I'm doing a very generic description here. Phase 2, this is the acute battering phase, the outbreak of serious violence. Something sets the abuser off. It can be very minor and may have nothing to do with the relationship or victim. This is really displaced anger. Maybe the perpetrator is angry at their boss at work, but of course they can't yell at their boss because they'll get fired. So they displace that anger onto someone that is less threatening. Low self-esteem makes victim feel helpless and powerless. Usually both the abuser and the abused underestimate the severity of the injuries. The person that's being abused may minimize what is happening to them. Phase 3, this is called the honeymoon of the respite phase. After Abuser many times appears remorseful. They promise to change. They'll never do it again. I'm going to change, honey. They try to win the SO's love back, significant other. They might apologize profusely, buy gifts, tend to her physical needs or his physical needs. And of course, the significant other wants to believe the abuse will never happen again. But the cycle is generally progressive with less and less of a honeymoon phase. So generally, without any intervention, this generally gets worse. Let's talk about the nursing process here. Well, what is our job? This person comes to the ER, or we're doing a home visit. We want to assess physically for bruises, broken bones. Don't fit an explanation. They come to the ER and they have a broken wrist, arm, leg, whatever, and the explanation doesn't seem to fit what they're explaining. We want to assess oral areas of the body, face, neck, genital area, and breasts. Again, we have to get permission for this, right? We just can't do this without a patient's permission. Assessment, psychological or psychosocial. Observe for timidity and fear of the significant other. Submissiveness. In our culture, people that are confident tend to have direct eye contact. If this person is gazing down toward the floor or looking toward the partner for permission to answer questions, we should take note of that. We might notice apprehension when attempting to answer these questions also. Signs and symptoms of anxiety and depression. Over time, people are anxious. They're waiting to be abused. Their self-esteem gets beaten down lower and lower. Try and ask questions away from the suspected abuser. So if you think that there might be some abuse going on, you might want to try to find a way to get that person that you think might be being abused away from the other person to talk about what might be going on here. And even if the person that you think is doing the abuse is not there, maybe the person comes in with a friend, most people are not going to admit in front of friends that they're being abused. So you want to get the person, the suspected victim, by themselves, talk to them privately. We want to assure them that all information is confidential. Revealing information does not mean the abuser will be arrested or prosecuted. We begin with open-ended questions, something like, I see you have some bruises. What happened here? As a therapeutic alliance is developed, more direct questioning can be initiated. Again, in the early part of this relationship, when you're meeting this person in the ER or wherever it may be, we're not going to start out with very personal questions. We're going to use open-ended questions. As you develop a therapeutic alliance, then we can ask, as you gain trust of the patient, then you could ask a more direct question, such as, did your partner cause these wounds? Assess, as previously mentioned, decrease shame and guilt by validating anxiety and anger. Okay, to feel anxious and angry is normal. Okay, we want to focus on the person's strengths. Maybe, again, it could be if it's a woman, we might say something like, despite all this abuse, you have managed to keep your children safe and protected. So we want to capitalize on strengths that the victim has. We can offer options, criminal prosecution, leaving, educate about safe houses. I know that many counties, including this county, have safe houses for women that they can go to get out of an abusive relationship. Make a plan to escape in the future. Maybe the person is not ready to leave, but maybe they can stash some clothes, some money, look at the transportation, addresses and phone numbers of a safe house. So they could be making a plan to escape in the future. If rape or severe abuse is suspected, we must inform the charge nurse, because this becomes a legal thing here. Every hospital has a hospital protocol involving rape. We have what's called in this county a SANE nurse, a sexual abuse nurse examiner. These are nurses that are specially trained. If someone is raped, saying they were raped, we would call this SANE nurse, who's specialized in handling the situation, to interview the person. And usually, of course, a nurse is female. If the person is female, that's a better fit. We would not want to have a man interviewing a woman about a rape that just occurred. That would be completely inappropriate. This person, the same nurse or the nurse involved here, wants to accurately document statements of what the patient's saying, using direct quotes stating exactly what the patient is saying. We can use a body diagram to mark areas of where there's wounds. This person would collect evidence, body fluids, pubic hair, things like that. And if the victim consents, pictures can be taken also. Let me go back here a little bit. If it is up as an adult, adults are considered competent. It is up to this adult to ultimately act and decide what they want to do. We cannot force the victim, a competent adult, to do what they don't want to do. Verbal interventions. We should address the reasons why a person remains in the relationship. Again, this might not be done in the ER, but if the person is brought up to the unit for either the med-surg unit or the psychiatric unit, excuse me, we might be talk about, this has been going on for a while. What's causing you to stay here? Again, we avoid asking why. Why is more of a challenge. Why do you do this? Maybe it's economic dependency that the husband or the abuser is bringing in money. Maybe it's religious beliefs. People are brought up in certain religions where you get married and you stay married no matter what. Again, loyalty and marriage vows. Maybe they say, I care, I love this person. I'm trying to help this person. I'm trying to help the abuser. What is their definition of love? And I can tell you, love is not taking a hostage. Love is elevating another human being to the greatest capacity that they want to achieve. In other words, love is not holding a person back out of fear they'll leave you. Love is letting somebody go to college, encouraging them to go to college, encouraging them to live their dreams. And if you're afraid that if they live their dreams, they're going to leave you, that's not really love. Okay. Guilt, maybe feeling that the person deserves to be abused. Over time, people get brainwashed and can literally think that they deserve this. Guilt, feeling that they deserve the abuse. False hope. He won't do it again. She won't do it again. It won't happen again. And again, usually this escalates over time. Maybe they have fear of being alone or fear of being killed. They may very well, because when the person does decide to leave, the risk of them getting harmed by the abuser increases exponentially. Conclusion. People living under constant terror eventually become worn down and confused, lacking the ego's strength to take action. And this is really brainwashing. When you isolate somebody and terrorize them and keep them awake day after day after day and just indoctrinate them in telling them they're worthless, things like that, that's a form of brainwashing. Abuse tends to escalate over time. If no treatment is obtained, abuser will probably not be able to stop on their own. We can offer solutions, but ultimately, as a competent adult, the victim must act. Again, if someone's deemed incompetent, then that would be a child less than 18 that does not have the legal ability to make decisions. Their parents would make those decisions, or a legal guardian. But an adult is considered competent. So again, if we suspect child abuse, we have a legal obligation to call in Child Protective Services. And the key here is just suspect. It is Child Protective Services' job to investigate and confirm or not confirm. We just need to suspect it. Now, if you see this, you're working in an ER and you see this, what you want to do is go up the chain of command and call in your boss, and they come in and take a look, and then that person will call in the doctor, and the doctor might speak to the lawyer and go up the chain of command. But you have a legal obligation to call in someone else, and if the chain of command does not act on it, then you must call in Child Protective Services yourself. But I would advise you, especially as new nurses working in the ER, perhaps is if you suspect something, you want to call in someone else with more experience than you. Okay. Again, we can offer solutions, but ultimately, as a competent adult, the victim must make the decision to leave or not leave. Abuse and violence, again, are seen in all strata of society. It's not, upper class, lower class, or whatever. It is non-discriminating. Okay, let's see what we have. That might be the end of this class. Oh, not quite yet. As you know, these things go on forever. Let's talk about elder abuse. It is defined as any act or omission, and neglect is omission, which results in harm or threatened harm to the health or welfare of an elderly person. Age 65 or above, I guess you're considered elderly at 65 or above. Estimated about 10% of the population have some kind of abuse. Can be physical, psychological, financial, or material. Many times the abuser lives with this elder person. Examples of elder abuse or neglect: physical, hitting, striking, shoving, restraining, again, without due cause. We always need an order from a physician to put somebody in restraint. Psychological would be yelling, name calling, harsh commands, threats, ignoring, silence, the silent treatment for no reason. Well, we would never give the silent treatment to an elderly person. I know, when a parent gets upset, they might give the child a silent treatment occasionally, but we would not do that to an older person. Uh, Social isolation, isolating that person, withholding affection. These are examples of psychological neglect or abuse. Financial misuse of someone's income. The elderly person has a retirement check coming in every month, and the caretaker, the child, the grandchild, whatever, is taking the money and spending it for their own needs, not for the person who earned that money. Sexual, again, this is self-explanatory. Neglect, withholding food or water, inadequate heating, unclean clothes or environment, lack of meds, eyeglasses, hearing aids, or false teeth. Again, neglect is a form of abuse. Neglect is just not doing what you're supposed to do. Common characteristics of abuser. Substance abusers under economic stress. Abuser is a victim of abuse or from a violent family. We spoke about some of this a few slides ago. Abuser is exhausted and frustrated by caregiver role. Many times the caregiver is living with this person and they can never leave. They can never get away. Okay. They're dependent on the victim financially. And again, they're isolated with the victim. This is why it's very important that we have nurses where it comes to a point where the person caring for their loved one, they simply can't do it anymore. And this is why we have facilities like assisted living and nursing homes where your loved one can live there, you can come visit, and professional nurses take care of this person. Characteristics of victim. Very interesting. White, female, age 70 or older, mentally or physically impaired, again, more dependent, unable to meet their own daily self-care needs, more dependent, um, and isolated with the abuser. The nursing process. Again, if you suspect abuse, you want to take the victim here and talk to them privately without the abuser around. You might ask, are you happy where you are living? Do you handle your own money? Do you have enough money to meet your needs? How do you get along with your caregiver? When you disagree, how is it handled? Is it a democracy or a dictatorship? Physical assessment. And of course, when we do physical assessment, particularly on an older person, we must take into account that when people are older, the healing time takes longer. So an older person can get a cut, and it's not going to heal as fast as a young child or a younger person. We look at their grooming. Are they disheveled? Are they appropriate weight? Unusual cuts or bruises, again, that might not meet the explanation they're giving. Undocumented broken bones on x-ray. You do an x-ray and you see that there was a broken bone, but it's not documented anywhere and the person doesn't admit to it. Okay. Occasionally people can have hairline fractures that they might not even know they have. So that's a possibility here. but we want to look into this more. And again, that leads to unexplainable injuries or unexplained injuries. The explanation does not fit the injury. Frequent UTIs, urinary tract infections, that could certainly be an indication of sexual abuse. Maybe there's a reluctance to seek medical care. Maybe they get medical care from many different locations where if they go to the same ER every time, the staff there are going to say, well, wait a minute, you were here 2 weeks ago. We don't get this. You're here again. So what might happen is that they might go to different ER, different hospitals, so nobody can connect the dots. Is the person overly sedated or consistent high blood pressure? In other words, they're not getting the medications that they're supposed to be getting because the person is not buying them their meds, is maybe pocketing the money, something like that. Once again, withholding treatment, medical treatment in this case, is a form of abuse. Nursing interventions. As I said before, you want to contact your nursing supervisor or LIP for guidance. That's the physician, the nurse practitioner, maybe the physician's assistant. We want to address the medical needs, preserving evidence as needed. This could really become a crime. Discuss options with suspected abuser if consent by victim. Okay, so that if the victim is competent, we have to get their consent. Maybe this person needs to go to an assisted living. Maybe they want to go to respite care. I know there are areas in this county where you can bring an elderly person to stay there for a couple of days to give the caregiver a rest. Maybe they want to get a live-in or part-time aide to take some of the pressure off the caregiver. Again, we can confer to the social worker, SW means social worker, for additional financial help or other resources. Social workers are experts in community resources. They know what's available in the community. Help for the abuser here. Maybe offer the abuser stress reduction techniques, exercising, having time for themselves. I mean, if you're with a person 24/7 and you can never leave this person alone because they have dementia, something like that, that becomes quite burdensome. So we might want to encourage this caregiver, say, can you get someone else to come in and take care of your dad while you go for a bike ride or a walk or hang out with your friends a little bit. Maybe if they're abusing substances, substance abuse counseling. If there's mental disorders, treatment for those mental disorders. Depression, anxiety would not be uncommon here. We can treat them with therapy, medications, things like that. Well, I guess this is over. We are done here. It was a pleasure having you guys. I know it's been a rather hectic semester. Again, I apologize for not getting this on a week ago, but I just finished the exam about 5 days ago. Again, it's been quite a hectic semester. In terms of child mental health, I would concentrate on the major, I sent you guys an email, concentrate on, ADD, ADHD, conduct disorder, oppositional defiant disorder, the treatments for those disorders, such as stimulants for ADD and ADHD, and the mechanism of action there is stimulants increase dopamine and norepinephrine in the frontal lobe. As we know, the frontal lobe, which is behind our forehead, has to do with executive functioning. Executive functioning is planning ahead, concentrating, using a calendar, remembering things like an executive. So if a child has ADHD, they don't have that ability is decreased a little bit, maybe significantly, and a stimulant kind of wakes up the frontal lobe so it can do its executive functioning job. It also, the frontal lobe has to do with impulse control. You have an impulse, but your frontal lobe says, don't blurt the answer out in class, raise up your hand. Some children with ADD or ADHD, or even adults for that matter, may blurt things out. When we activate the frontal lobe with a stimulant, the frontal lobe can control behavior more readily. So know the big ones that I just mentioned, the treatments. Tic disorder, or Tourette's is a part of it, is involved with a tic disorder. The treatment there many times are antipsychotics because it seems to be that a tic disorder has to do with an abnormality of dopamine functioning. Okay, we know that antipsychotics block the dopamine receptor, so the dopamine is effectively reduced. I'm trying to think of anything else that you should know for this test. the questions about uh, child are quite general. Okay. Anyway, again, feel free to contact me. I believe you have my phone number. Okay. Hang in there. It'll all be over in about 2 weeks. Let's see. I think we're starting that over. Okay.